I'm now joined by Kevin Alexander, one of our outstanding new faculty members in the division, and I want to chat with him a little bit about his research, his journey, his clinical work, and just to thank you for joining us, Kevin.
Yeah, it's good to be here, Josh. Yeah, thanks for having me.
You did not do your general cardiology training here, but you did do your advanced heart failure training. Tell us a little bit about how that worked and what you felt like that exposure was like.
Yeah, so I did most of my training on the East Coast. I was at Hopkins for residency and Brigham for general cardiology fellowship, and was fortunate to have the opportunity to do my advanced heart failure training at Stanford. And that was a very pivotal experience because it really springboarded my transition to junior faculty. I ended up staying here at Stanford. And, I think with my training path, I've gotten exposure to a lot of great institutions and colleagues. And so kind of gives me a perspective on what stands out. And at Stanford, I think what I was struck by was a number of things. So the collegial atmosphere, in particular amongst the attendings and fellows, very kind of supportive, and a space where the trainees can really grow and have autonomy. And that was really striking to me. And then I think whenever anyone that's looking at an academic career of any sort, it's important to be in an environment that has appreciation and skill for both the clinical side and research side. And I think Stanford has a nice blend of both of those things. They kind of work synergistically. They're not siloed entities, but really integrated with each other in a good way. And so those were all terrific aspects for me as a physician scientist who who does amyloid research.
Yeah, that's a great answer and a great segue into my next question, which is why don't you tell us a little bit about what your research is right now and what Stanford has offered you in that space.
Most of my time is doing work around cardiac amyloidosis. It's a important question, clinical and research question, because we're realizing that's a important but underdiagnosed and poorly understood form of heart failure. And so I'm interested in doing bedside to bench type of research. So taking clinical observations for relevant problems and trying to better understand them from a molecular mechanistic standpoint. So in order to do that, I rely on clinical data as well as collecting blood and other tissue samples from patients, and then being able to take that to the lab to do different profiling studies. So in order to execute something like that, you need to have an environment or infrastructure in place that allows you to focus on that translational piece. And so what's been great about Stanford is that that infrastructure already existed before I came, and so it was a very kind of seamless transition to integrate myself into that. And so what I mean by that in my particular case, on the clinical side, you have Ron Watalis, who is an amyloidosis expert and co-founded the Amyloid Center here about a decade ago, and so already had an extensive track record forefront of clinical care. And then my mentor in the lab, Rongli Liao, who I've worked with for several years now, has decades of experience doing molecular in cardiac amyloidosis, but other forms of cardiac disease. So that really allowed me to carve a niche of translational research and have those two senior mentors as pillars.
Yeah, I mean, it must be exciting to be in a field like cardiac amyloid where, we're now able to treat things effectively. What do you think is the future for amyloid here at Stanford?
Yeah, that's a great question. It's been an exciting last couple of years with three drugs that have become FDA approved, and I think it's just the beginning, because now more than ever it's important to identify patients early. So it's no longer a terminal disease where you can diagnose it and say, well, there's nothing to do about it. Now we have treatments, and all three of those treatments work the best in people that have little to no amyloid deposition in organs, because the drugs really prevent new amyloid from forming, but we don't think do much to remove existing amyloid.
Mhm.
So improving efforts in terms of screening algorithms and finding biomarkers that can pick up the disease early is going to be key. And so I think that those are important areas of research. And then another area for targeted therapeutics would be developing drugs or other interventions that can help clear amyloid that's already deposited in tissues. So even though there's treatments available, I think that it actually is the end of the beginning, so to speak. And now we're really moving into a phase where I think there's going to be a lot of innovations in the field.
Yeah, I think that's a really good point, and I like the fact that Stanford seems to be well positioned, for that. You have to have a pretty large catchment of heart failure patients for that. Maybe you can tell us a little bit about your experience in the heart failure fellowship, what kind of volumes you were seeing, and the kind of referrals that you're getting on a regular basis.
Yeah, so the fellowship was terrific because we it's a Stanford's a high volume transplant center, and so we have a large catchment area and get patients throughout the state of California and sometimes the neighboring states, and so you get a lot of bread and butter type of heart failure cases, but then you also get some of those unusual cases that may be referred from smaller centers. Because Stanford has a particular expertise. One example would be with cardiac amyloid. Stanford has one of the largest experiences transplanting patients with cardiac amyloidosis, and we just published that in JACC Heart Failure a couple of months ago. And that's just one example. There's a lot of innovation around multi-organ transplants at Stanford, as well as transplanting for some less common indications for certain types of cardiomyopathy. So to be in that environment for training uh, is exceptional, and I'm really fortunate to have been a part of the fellowship.
One of the aspects of mentorship that I see in your case that's important is advancing your career nationally. And maybe you can talk a little bit about how your mentors have helped you get on the national stage to display your talents.
When one's launching a academic career, obviously the research and clinical expertise are important, but you need people that are supportive of giving you recognition more broadly outside of your institution. And so whether that is presenting at conferences or being on guidelines or committees, all of those things can be really crucial at early stages. And so in my case, I could probably list a dozen people that have supported me in this way. But to kind of keep it, or to, since we talked about Rongli and Ram Watalis, both of them have supported me immensely in the AHA, for example. I'm on the early career committee for BCVS currently, and I've been tapped to for a committee that's developing a webinar series for TTR amyloid through the AHA, and those are just a couple examples, but opportunities that I've been that my mentors have supported me with.
I really like to hear that because it is so important. It takes more than one person to succeed nowadays. In that vein, you're just coming on to faculty not too long ago. Tell us how you felt supported as a junior faculty member, and whether you have the resources that you need to feel like you can launch an independent career.
Yeah, it's an interesting transition. I remember, interviewing at different stages of my training, people would always ask kind of what do you think the most difficult aspect of a training or career is? And, I always said that the fellow to faculty transition is probably the most challenging. And I still agree with that. And I think a lot of that stems from the fact that it's the first time in a while where you're going into a career or a job where you don't have the same kind of structure, meaning when you're a fellow, you kind of know what the clinical rotations are and what the expectations are, and by the time you're PGY 6 or whatever, you're very good at it. But when you transition to faculty, it really is choosing your own adventure and kind of carving out what you want to do clinically, what you want to do research wise, what kind of physician you want to be. And so it's, with all the opportunities that are available, it can be a challenge to kind of decide how the breadth and depth in which you want to do things, because you kind of have to focus, but then also you want to avail yourself of some of these opportunities. And so, I think Stanford's been great in that they've given me a lot of guidance and support in navigating that kind of with, Rongli and Ram Watalis, both of them have helped kind of focus me. But then also I think from the program leadership, from the chair of medicine to the chief, section head for heart failure, they've all I've sought advice with them throughout the year to get an idea of kind of what I should be pursuing, but then also when I have ideas, people have been supportive and help direct me to where the resources are. So that's something that I think is really important. And I don't know if every place that kind of has that level of support, direct support.
What really were the deciding factors that, said, I'm going to stay at Stanford to launch my career?
For me, I could see a path forward in terms of establishing a niche in this area of amyloidosis and heart failure. And there are a lot of examples of junior faculty, maybe a few years to 5 years ahead of me, who are thriving. And so it was very kind of, I think you want to be at a place where you see people that are doing some work similar to what you want to do, and to see kind of how they're supported. And there's numerous examples of that at Stanford, of physician scientists who are able to balance a good clinical workload and be productive in the lab. And that's exactly the kind of career that I wanted. And so that was a strong driver in me wanting to stay.
I also wanted to ask a little bit about, diversity and inclusion. World of cardiology, the world of medicine has struggled both with attracting women to cardiology and also men from underrepresented groups. Talk to us a little bit about your journey in that regard, and whether you feel like Stanford is on the right path to decrease the disparities that exist.
Yeah, I think they're doing a terrific job in this aspect. Shortly after I arrived to Stanford, I was approached by the Office of Diversity here and attended some of their events. And so very early on, that allowed me to kind of network with other peers and near peers and kind of hear what their experiences have been as they've transitioned from fellowship to faculty. So that's been great. And then also that connection allowed me to network with people that were a little bit more senior to get that support as well. So I think developing a fostering environment like that is key. And then with more specifically within the division of cardiovascular medicine, there's a number of my peers like Fatima Rodriguez and Vicky Parikh, who I knew through various stages of training, who are kind of peers with me. And so I think that there are other examples of people that the university and the Department of Medicine are supporting in that effort to to promote diversity and inclusion. So that's been terrific.
I think you and Fatima both have a Harold Amos Award. Is that right? Maybe.
Yeah.
So that's also been a great thing for Stanford to see. Is that on amyloid as well?
That's on amyloid. Yeah. So for that award, I'm looking at a particular variant of cardiac amyloid caused by V122I mutation, which is carried by a large proportion of African Americans and gives a disproportionate burden of cardiac amyloid disease among African Americans. So it's kind of, I think an important research question, but then from a societal point of view, it's important to narrow this racial disparity in terms of heart failure.
Oh my gosh, it's critically important. And I think with people like you and Fatima on our faculty, the future is very bright. So is there anything that I haven't asked you that you wanted to comment about?
Yeah, I mean, I'll comment briefly on the fellowship. I've been universally uniformly impressed with how skilled and compassionate the general fellows are here. Even though I didn't do my general fellowship here, I interact with a lot of the general fellows when I was a heart failure fellow, now as an attending. People are just very on top of things, take ownership, and I think they get a lot of hands-on experience. So for example, I have one of my clinic patients in the hospital this week, and the fellow on consults has given me updates almost every day, and it's been, really, feel, comfortable that the patient's in great hands, and I really appreciate that kind of commitment. So, whatever it is, whatever you're doing, Josh, I think you have a great group of fellows and a great program, and it's very easy to see.
Oh, that's great. I didn't even prompt you with that question, so I love that.
Yeah,
And
yeah,
I think that fellow might be Neil Kalwani, who
yeah, that's right.
we'll be
Yeah,
talking to later. So, but
yeah,
anyway, thanks so much, Kevin, and have a great rest of your day.
yeah. You too, Josh. Yeah, hope you enjoy the fourth.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.